So what are my thoughts about laser for diabetic retinopathy? Allow me to be very crystal clear about this subject. Laser for specifically one form of diabetic retinopathy that is called proliferative diabetic retinopathy is a revolutionary thing. It's an amazing thing. I advocate for it all the time. And what are we really referring to? Remember in the floater video, we discussed how there can be bleeding inside of the eye from diabetic retinopathy. Why does this happen? Because the retina on the inside of the eye, it does not receive enough blood at first in like little tiny quadrants in the retina. And then the vision still remains okay. But if the A1C stays high, if the blood sugar stays high, if the blood pressure and cholesterol stay high, then those little quadrants in which the blood vessels are not receiving enough blood get bigger and bigger and bigger over time. And at some point, the retina essentially tells itself, I can't live like this anymore. If I'm not going to get enough blood in this giant patch or that giant patch, then it starts to form new blood vessels. And these new blood vessels you would think are a good thing, because the idea is to supply those territories of the retina that aren't getting enough blood. But they don't do that. They don't supply those areas with new blood. They just feed themselves. And the new blood vessels that grow on the surface of the retina, they're very fragile. So they bleed really easily. They'll fill the whole eye with blood. Just yesterday, I saw two people who are totally blind in one eye because the eye is full of blood from diabetic retinopathy. So how do we treat that? Well, at first, the best thing to do is do eye injections. We inject a class of medication called anti-VEGF medications with such medications as Avastin, Lucentis, Vabysmo, Eylea, etc. But once the bleeding has stopped, then we have to ask ourselves, what's the next step? Well, we have basically one of three options. One option is do nothing, and I do not recommend that because nothing ultimately leads to bleeding and blindness again. Option number two is to do injections at some regular interval. Maintenance, in other words. Visit every 2-3 months, do an injection inside of the eye, even if the vision's perfect, just to maintain things. And some people do really well like that because the other options don't sound as good to them or they can't tolerate them. And the third option is to laser the retina. When we laser the retina, we only laser in the peripheral part of the retina. The center part of the retina, the macula, we should never laser that territory. I guess I shouldn't say never, but we should very rarely laser the very middle of the retina and the macula. And the reason why is because when you apply laser into the center of the retina, you're also applying laser into the center of the vision. And so if there's a laser spot in the very middle of the retina, it may cast a shadow at some place in the central vision for life. I'm not a fan of that. I don't like harming people, and I perceive that lasering the very middle of the retina may be harmful as a general statement. There may be exceptions to that, given the right person and training and so on, but lasering the peripheral part of the retina that is outside of the macula, that's very safe. And once enough of it is done, then someone will stop bleeding forever. It has a curative effect. It doesn't cure diabetic retinopathy, it doesn't cure diabetes, but it does permanently prevent bleeding for most people. I say most people because it's not 100% effective for every individual with proliferative diabetic retinopathy, but it certainly does a really good job. It was developed where I went to retina fellowship. I'm really biased toward doing this procedure. And why would I be biased? Because I've seen people who have bleeding episodes, they have eye injections, they don't undergo laser, they miss appointments. Maybe they think I'll just get a regular eye injection to prevent bleeding. But because of all of the things that happen in life, people miss appointments. Diabetes is tough to live with. You have to deal with like foot infections and heart diseases and all sorts of trouble like that. And so it's hard to come back to the ophthalmologist, to the retina specialist to get an eye injection. So if you miss an appointment, then the eye starts to bleed again, etc. And so laser, once enough is delivered, does a really good job at preventing bleeding. In fact, in one of the two people I met yesterday who was blind in one eye, the other eye was not blind in both people. And why? Because both people had received adequate laser to prevent bleeding. So what's my opinion about laser? It's great. I always encourage it. It may not be perfect for everyone. It may not be 100% effective for everyone. But nevertheless, I'd say as a general matter, it is very effective.